Hey there, and welcome back to the Deep Dive.
Hello.
Today we're jumping into a topic that affects quite a few older cats, hyperthyroidism.
Very common.
It sounds complicated maybe, but we're going to break it all down.
Yeah, we'll cover what it is, maybe why it happens, what signs to look for.
Right, and what the vet does, the treatments, all that stuff.
Exactly. The goal is really just to give you, the listener, a clear picture, especially if you're just noticing things or got a recent diagnosis.
Because it can sound kind of scary, can't it?
It can, but honestly, it's very manageable these days. Lots of options.
Good. So let's start at the beginning. What is hyperthyroidism, basically?
Okay, so sometimes you'll hear it called thyrotoxicosis too.
Thyrotoxicosis, got it.
Yeah, and it just means the thyroid gland. It's this little gland in the cat's neck. It gets enlarged and, well, it starts producing way too much thyroid hormone.
Too much hormone, like T3 and T4. I think I read that.
That's them, T3 and T4. Think of them as like the body's thermostat or volume control. With hyperthyroidism, that volume is cranked way up.
Okay, so why does the gland go into overdrive? What causes that enlargement?
Well, the good news is in almost all cases, like 97, 99%, it's caused by non-cancerous growth. It's called an adenoma.
An adenoma. So benign.
Benign, yes. Just a little bump on the gland making too much hormone. Much less often, maybe only 1 to 3% of the time. It can be a malignant tumor, an adenocarcinoma.
Okay, but that's rare, thankfully.
Very rare. It's usually the benign kind.
And you said these hormones affect, like, everything.
Pretty much. They play a huge role in regulating metabolism, which touches almost every organ. So, yeah, when they're too high, you can see all sorts of different signs and even secondary problems develop.
Right, okay. That makes sense why it can cause so many different issues. So we know what it is, but why does it happen? Do we know the trigger?
That's still the big question. The exact cause isn't really pinned down. It seems like it's probably a mix of factors.
Not just one thing, then. A bit of a puzzle.
Kind of, yeah. Research points to a few possibilities, though. Diet is definitely one area being looked at.
How so? Like, what's in the food?
Could be deficiencies or maybe excesses of certain things in their diet. There's also talk about chronic exposure to chemicals.
Chemicals? Like in the environment?
Possibly. Things like flame retardants, maybe pollutants, stuff that might disrupt the thyroid over time is still being investigated.
Interesting. I feel like I read somewhere about specific cat foods.
Yes. There have been some studies suggesting a potential link with fish-flavored canned food diets, particularly, but it's not definitive proof, more like an association found in some studies.
Okay, so maybe something to keep in mind.
And iodine levels in the diet are another piece. Iodine is needed to make thyroid hormones, right?
Mm-hmm.
So maybe too much dietary iodine in cats that are already susceptible could push things towards hyperthyroidism.
Huh. So many potential factors.
Exactly. And then there's just age. That's a big one.
It's mostly older cats.
Yeah, it's definitely a condition of middle-aged and senior cats, usually diagnosed around 12 or 13 years old, typically not seen much in cats under 10.
Okay, so something to be more aware of as they get older. Let's talk signs. How would I know if my cat might have this? What should I be looking for?
The signs often start off subtle
You know?
and then get worse over time. But the classic sign, the one we see most often, is weight loss, despite a really good appetite.
Wait, so they're eating more but losing weight?
Exactly. Sometimes they seem ravenous, like they can't get enough food, but they're still getting thinner. That's a huge red flag.
Okay, that's a big one to remember. What else?
Increased thirst is very common. That's polydipsia.
Mm-hmm.
And because they're drinking more, they're urinating more, polyuria.
Right, more trips to the water bowl and the litter box.
Mm-hmm. And hyperactivity or restlessness. Your normally calm cat might suddenly seem wired, pacing, maybe even a bit cranky or aggressive sometimes.
Picky cats. I know a few of those.
Huh, yeah. But a change in behavior is key. You might also see vomiting or diarrhea more often.
Okay. Anything else common?
Their coat condition can change. It might look unkempt, maybe greasy or matted. And increased vocalization is another big one.
More meowing.
Yeah, especially at night sometimes. Those random middle-of-the-night concerts might actually mean something.
Good to know. My cat's practicing his opera nightly. Any other signs?
Yeah, sometimes rapid breathing, maybe even difficulty breathing in more advanced cases, a fast heart rate, which your vet would pick up. Sometimes you can even feel a lump in their neck when you pet them. That's the enlarged thyroid gland.
Wow, you can feel it yourself.
Sometimes, yeah. And weirdly, thickened nails can also happen.
Thickened nails. That's an odd one.
It is, isn't it?
Yeah,
So quite a list of common signs.
definitely. Are there ever cases where the signs are different? Or less obvious?
Yes, absolutely. We call them atypical signs. Happens in maybe less than 10% of cats.
And what do those look like?
Sometimes it's the opposite of the classic signs. Instead of a huge appetite, they might have a poor appetite or even stop eating.
Oh.
They might be lethargic, weak, seem depressed, not hyperactive at all.
So it's not always the bouncing off the walls while wasting away his picture.
Not always. Which is why, any significant change in your older cat really warrants a checkup. Don't just assume it's old age.
That's really crucial advice. Okay, so say I notice some of these things, especially the weight loss with the big appetite. What happens next? How does the vet diagnose it?
First step is definitely a vet visit. They'll do a full physical exam that includes carefully feeling the neck area, palpating for that thyroid slip, that enlargement. They'll listen closely to the heart, check the rate and rhythm, and probably check blood pressure too.
Standard stuff. Then what? Blood tests.
Yep, blood tests are key. They'll likely run a chemistry panel to check organ function generally.
Right.
But the specific test is for thyroid hormone levels. Usually they start with total thyroxine, or TT4.
TT4. And if that's high?
If the TT4 level is clearly elevated, that's usually a pretty strong confirmation of hyperthyroidism. Most affected cats have high TT4.
Most. But not all.
Right. And this is important. A small number of cats with hyperthyroidism can have TT4 levels in the normal range, especially early on, or if their levels fluctuate.
Oh, okay. So a normal test doesn't automatically rule it out.
Not always, no. If the cat's symptoms are really suggestive, but the TT4 is normal, the vet might need to do more digging.
Like what kind of digging? What other tests are there?
Well, there's another blood test called free T4 by equilibrium dialysis, or FT4 by ED. It measures a different form of the hormone and can sometimes be elevated even when TT4 is normal.
FT4 by ED. Okay.
Or they might do something called a T3 suppression test, or recommend a thyroid scan. That's scintigraphy, usually done at a referral hospital.
A scan, like an imaging test.
Exactly. It uses a tiny bit of radioactive material to light up the thyroid tissue on an image, showing if it's overactive. Or sometimes, the simplest thing is just to repeat the TT4 test in a few weeks.
To see if it's changed.
Yeah, to catch it if the levels were just fluctuating that day.
Gotcha. And you mentioned checking other organs too, like kidneys and heart.
Super important. Because hyperthyroidism puts extra strain on the body, especially the heart and kidneys, vets need to assess overall health. That initial blood chemistry panel and a urinalysis give them a good look at kidney function and other things.
And does that also help rule out other diseases?
Absolutely. Things like chronic kidney disease or diabetes can have some overlapping signs, like increased thirst or weight loss. So the tests help make sure we're treating the right thing.
Makes sense.
And depending on findings, they might recommend checking the heart more closely with an ultrasound, an echocardiogram, or chest x-rays, maybe an ECG, before starting treatment, just to get the full picture.
Okay, so it's a thorough process. Once hyperthyroidism is confirmed, what are the treatment options? You said there were several.
Yep, 4 main routes: medication, radioactive iodine therapy, surgery, and dietary therapy.
4 options. How do you choose?
It depends on the cat's specific situation, their overall health, any other conditions, the owner's ability to give meds, cost considerations, lots of things factor in.
Let's break them down. Medication first, like pills.
Yeah, usually antithyroid drugs, with methimazole being the most common one. It works by slowing down the thyroid's production and release of hormones.
Does it cure it?
No, that's key.
Yeah.
Medication controls the condition, it doesn't cure it. So it's lifelong treatment.
Ah, okay. What are the pros and cons?
Pros are it's widely available, relatively inexpensive, and good for stabilizing a cat before maybe doing another treatment. Cons are needing to give it usually twice a day, every day, for life.
Which can be hard with some cats.
Totally. Though there is a transdermal gel form you can rub on the ear skin, which is often much easier.
Oh, that's good. Any side effects?
There can be. Some cats might get vomiting, loss of appetite, maybe lethargy. Less commonly, more serious things like liver issues or blood cell problems can occur.
So you need to monitor them.
Definitely. Regular blood tests, usually every 3 to 6 months, are essential to check hormone levels, kidney function, and watch for those side effects.
Okay, so medication is management with monitoring. What about radioactive iodine? Sounds intense.
It sounds dramatic, I know.
Ugh.
I 131 therapy. But it's actually often considered the treatment of choice.
Really? Why is that? How does it work?
It's a single injection of radioactive iodine. The thyroid gland naturally takes up iodine, right? So the overactive tissue grabs this radioactive version,
And then
the radiation locally destroys the abnormal overactive thyroid cells without harming nearby tissues much. It's very targeted.
Wow. So the benefits are?
The biggest benefit is it often cures the hyperthyroidism. High success rate, like 95% cured within a few months. Usually no long-term side effects, no daily meds afterwards, no anesthesia needed for the treatment itself.
That sounds amazing. What's the catch?
The main things are cost. It's more expensive upfront and availability. It has to be done at licensed facilities because of the radioactivity.
Oh, okay.
And the cat has to stay hospitalized for a few days, usually 3 to 5, until their radiation levels are safe. And usually no visitors during that time.
A short stay for a potential cure, though?
Exactly. Very rarely it can make them a hypothyroid, meaning too little hormone, which then needs supplementation. But usually it works great.
Okay. What about surgery? Just removing the gland?
Surgical thyroidectomy, yeah. Removing the affected gland or glands. It can also provide a permanent cure, which is a big advantage.
But surgery has risks, right? Especially for older cats.
It does. General anesthesia always carries risk, particularly if the cat has heart or kidney issues, which hyperthyroid cats often do. And there's a specific risk of damaging the tiny parathyroid glands nearby.
What do those do?
They control calcium levels. If they're damaged, it can cause dangerously low blood calcium, which is a serious complication needing urgent treatment.
Yikes. Okay.
So, because of those risks, and because meds and I-131 are so effective and less invasive, surgery isn't the go-to as often anymore. It might be considered if only one gland is affected, though.
Right. Usually stabilize them with meds first.
Often, yes. Use Methimazole for a few weeks beforehand.
Okay. Last one. Diet therapy. How does food treat this?
It's about severely restricting iodine intake. There's a prescription diet. Hills-Yard is the main one. That's extremely low in iodine.
And less iodine means less hormone production.
That's the principle. If the thyroid doesn't have the building blocks, the iodine, it can't make as much hormone.
Is it a cure?
No, like medication, it's management, not a cure. And it requires absolute strictness. The cat can only eat that food. Nothing else. No treats, no other cat food, no human food scraps, zero.
Wow, that sounds tough to enforce.
It can be, especially in multi-cat households. It's also a bit controversial. There are some concerns about long-term health effects of severe iodine restriction.
Right.
Research is ongoing.
So discuss that one carefully with the vet.
Definitely. It could work for some cats, maybe those who can't tolerate meds or aren't candidates for I-131 or surgery, but that strict adherence is non-negotiable.
Okay, that covers the main treatments. Whatever path is chosen, what can owners do at home to help their cat?
Great question. Consistency is key, whatever the treatment. If it's medication, give it exactly as prescribed, on schedule. Watch closely for side effects and report them.
Right. Be diligent.
If it's the special diet, you have to be the food police. Only that food, period.
Food police. Got it. What about general care?
Always have fresh water available. Monitor their drinking, eating, urination, weight, activity level. Keep track of trends. Report changes to your vet.
Okay.
Try to keep their environment calm and low stress, since they can be prone to anxiety. Be patient if their behavior is off the meowing, the crankiness. It's often the condition talking.
Patience is important.
And definitely keep up with those follow-up vet appointments and blood tests. They are absolutely crucial for monitoring treatment effectiveness and catching any issues early, like kidney problems that might get unmasked when the thyroid levels normalize.
Unmask? How does that work?
Hyperthyroidism can artificially inflate kidney filtration rates. So when you treat it, sometimes underlying kidney disease becomes apparent in the blood work for the first time. It needs careful monitoring.
Ah, I see. So follow-ups are vital.
Absolutely. And maybe think about pet insurance early on, before things develop. And always talk openly with your vet about options and costs. There's usually more than one way to approach things.
This has been incredibly helpful. It sounds like, yeah, it's serious, but definitely not hopeless.
Not at all. It's very manageable. Early diagnosis helps a lot. Working with your vet helps a lot.
So observe your cat, talk to your vet, find the right plan.
That's the core message. With proper care, these cats can live long, happy lives.
Definitely reassuring. It really makes you think, doesn't it? Considering how subtle those first signs can be sometimes. What little change in your own cat's routine or behavior might be whispering something important, maybe something worth a closer look or just a quick call to the vet.
Being observant is half the battle.
Well, thanks so much for breaking all that down for us today.
My pleasure.